In the Checkmate 9ER trial, it compared combination of cabozantinib with nivolumab to sunitinib alone, which is a VEGF TKI. It showed improved progression-free survival and overall survival in the combination arm. The grade 3 adverse events were 75% with the combination, and I believe around 70% with the sunitinib. And I think we'll see what Laura wants to say about the quality of life issue. I'm not going to steal her thunder, but I think you have to look at the comparator to really make that data stick. What do you think, Laura?
Yes, I'm learning more and more about the value of the quality of life data because we're really looking at it from the patient's eyes. It's what they've experienced. And I think the interesting thing, having been involved in a lot of the clinical trials and having really gotten that quality of life data for sponsors in clinical trials, is looking at the Checkmate 9ER data. They did not see deterioration in quality of life in spite of what you alluded to, Virginia, which was a fairly significant toxicity profile. So even dealing with those high percentages of side effects, quality of life was maintained. And that's an important factor. Megan, how do you use quality of life data or the 9ER data in your clinical practice?
I think the quality of life data, like you said, is really a surrogate for us in the overall tolerance of the patient too. It's really what we need to feel justified in treating the patient safely while respecting the quality of life. Ultimately is, I think, the biggest issue, because even when we're seeing progression-free survival, when we're seeing overall survival, any of that data, if it doesn't correlate to improved quality of life overall, that doesn't help the patient. When we want to see that data, and it's great, and we see those nice separation in the curves, it's fantastic. But when we actually see that a patient can function and can go to life events and can participate in weddings, that is the exciting data for us. And I think that's why we're all in this field, to be completely honest. So I think quality of life data in clinical trials and in these combinations in general should be the largest focus for us when we're looking at incorporating it into the real world practice. Because it does correlate secondarily, of course, to the primary endpoints as well.